So how do you tell the difference between a congestive heart failure exacerbation versus just a upper respiratory infection or some kind of lung infection in general? One of the first things that you can look at is weight changes. It's a good idea, every single congestive heart failure patient, that you always make sure to get a weight and also talk to the patient about if they've noticed some weight changes. Also, listening to their lungs, listen for things like crackles and wheezes. Sometimes this can be somewhat difficult if they have COPD and or if they have bronchitis going on, things like that. It can be difficult to tell. It has a wet sound with the crackles, usually when it is fluid overload. Look at their legs as well. They may always have some baseline with congestive heart failure. They may have some baseline of leg swelling, but it shouldn't be past their baseline that you typically see with this individual. Also ask if they're taking the diuretics. If they've stopped taking the diuretics often, that can bring on an exacerbation of CHF. Look for jugular vein distension. Ask about orthopnea. So when they're laying down, do they get more short of breath past the baseline? CHF patients always have somewhat of a baseline a lot of times of the orthopnea. Ask about shortness of breath. Once again, is it past their baseline? And then a very important thing to ask is, what is new? I always tell students when I'm teaching them, ask what's changed, what's new. Have they started any new medications, specifically things like steroids, and also things like if they've had a calcium channel blocker. Those are things that could potentially increase the risk for an exacerbation. Has their diet changed? Have they been eating more salt? Have they been drinking a lot of fluids? If it's around a holiday that they've been celebrating. And of course, we rely on things like x-rays, BMP, CBC, and point of care test.